Good morning, everyone.
Good morning, Ron.
Good morning.
So good morning to everyone. I am showing 8:30 on my clock. This is Gail Weaver. I'm chair of the Yakima Health District Board of Health, and I'm calling the meeting of the board to order. We will start with introductions of guests and staff. And Ryan Ibeck, can you help with that?
Yes, Barbara Hare, Mayor of Hera, City Representative. Barbara, you there? Okay. Ron Anderson, County
Here.
Commissioner. Norm Childress, County Commissioner. Okay, Dr. Kay Funk, Yakima City Council Member, City Representative. Okay. Vicki Baker, County Commissioner. Okay, Dr. Sean Clary, Citizen Member.
Present.
Gil Weavers, Citizen Member, Board Chair.
Present.
All right, we'll go back to Barbara Hare. Norm Childress. Vicki Baker. Okay, we'll go back. We'll go back. Yakima Health District staff, Andre Fresco, Executive Director.
Here.
Chase Porter, Senior Finance Manager.
It shows that he's still connecting to audio.
Okay. Melissa Sixberry, Director of Disease Control.
Here.
Lillian Bravo, Director of Public Health Partnerships.
Good morning, here.
Sean Mcgee, Environmental Health Director.
Here.
Nathan Johnson, Local Emergency Response Coordinator. Dr. Teresa Everson, Health Officer.
Good morning, here.
Wendy Garcia, Public Health Technician.
Here.
James Elliott, Attorney.
Good morning.
Victoria Reyes. Victoria, are you there?
Ryan, Victoria's here. She's just helping with Barbara Herr to get on the
Okay.
Board of Health meeting.
Thank you. And we'll go back to Vicki Baker. Okay, Norm Childress. Okay, do we have any guests or press?
I'm a guest, Amanda McKinney.
Thank you. Any other guests or press?
I'm Bob Romero.
Okay, thank you, Bob. Okay, any other guest or press? Okay, we'll go back one last time. Vicki Baker. Okay, Norm Childress. And Barbara Herr. Okay, anyone else on the call, on the meeting?
This is Tonya Brett. I'm the new public health nurse here at the health district.
Okay, thank you, Tonya. Is Minako on?
We also have Minako on the line too. She's our new accountant. I think she's having kind of the same issues as I am. I don't see her dial in yet.
Okay, thank you. All right, Gail.
All right, thank you very much. We do have a quorum of the board. We will check back, and please, if anyone else joins the call, will you please identify yourselves as we go through. So our next agenda item is a review of the submitted public written comments, which were submitted by 3 o'clock yesterday. So again, Ryan Ibach, Chief Operating Officer.
Okay, we do not have any written comments that were presented to be read to the board. If there are any written comments, they are due the Tuesday before the meeting, so yesterday at 3 p.m. And we do review them with our attorney, James Elliott, and they're gone over and submitted to the public as part of our packet.
Okay, thank you very much. Next agenda item is the consent agenda. We have 2 items on the consent agenda: the July 29th, 2020 Yakima Health District Board of Health minutes and payment of accounts payable and payroll issued in July 2020. And I would entertain a motion to approve the consent agenda.
This is Ron Anderson. Move to approve.
Is there a second?
This is Sean Cleary. I'll second.
Thank you, Dr. Cleary. Any discussion? Okay, for board members, all those in favor signify by saying aye.
Aye.
All those opposed, same sign. Okay, we will go on to board business. Andre Fresco, Administrator.
Thank you. Thank you, Gail. Good morning to our board and to our guests. Thank you again for joining us. And we also appreciate your patience as we navigate communication tools. Again, there's no perfection during this response, and we find ourselves using communication tools, and we try to refine it as best we can. So thank you for your patience. I wanted to review a few things with you, but I'd like to begin by asking for your consideration. I have two different updates, update on our COVID-19 investments and also just a general COVID-19 update. I'd like to merge those two for the purposes of time. And we actually have a presentation, a PowerPoint that I'd like to share with the board that I think would illustrate what we've been doing. We have been working very hard on investments, both in staff and initiatives and finances over the last few months, but I want to attempt to make it as clear as I can because there's so many moving parts that I think it can be very distracting. So I'm going to ask if Victoria could place the PowerPoint on the screen, please, and we can review it together. Victoria, Wendy, is that something that we can place on the screen?
Yeah, we're doing that right now.
Thank you so much.
Andre, did you get that I checked into the meeting? It's Norm Childress. I was having problems with my network.
Thank you, Commissioner. Grateful that you joined. Well, I'll begin while we're waiting for that to come up. We discussed at previous meetings that we have received investments from the State Department of Health for increased ability to surveil and oversee the process of COVID-19 in our county. Again, we're trying to create structures and systems that are best practices, not only for us in our county, but also for Eastern Washington. We were hit with many circumstances early on that other counties are now encountering, like large outbreaks in long-term care facilities, large agricultural facilities, farm worker housing, jails. And so the state has realized that we are really creating systems real time that others can benefit from. So that's where a lot of our investments are being created. Again, that was, thank you, Wendy and Victoria, for putting that up. That was investments of anywhere from $6 to $10 million that isn't coming directly to the Yakima Health District, but it is money that is funding these large initiatives. So I wanted to explain this and go through the fact that we're talking about new staff being included at the health district and also funding that's going to be received at the health district. So if you don't mind going to the next page, please. Thank you so much. So one of the reasons that we are interested in moving forward with investment in new staff is that we are considered a medium-sized health jurisdiction in this state, but we really have a small staff. And so our staff have been working overtime and an admirable job at balancing the needs of our regular regulatory authority work and also the work of COVID-19. And again, we've done outstanding work, I believe, and my hat's off to the staff. But we recognize that this will continue for many months to come. And so we are investing in a new structure that allows us to move forward with additional staff because we realize that we're going to have to continue things like community-based testing sites and disease investigation throughout the fall and winter. So that's where we find ourselves. If you don't mind going to the next slide, please. So we've worked with the state on creating 3 different team approaches that we believe are necessary to create a strengthened response to COVID-19. These are things that we believe strongly in, and I'd like to just go through them. Happy to answer questions at the end, or please feel free to stop me at any time. We have 3 different groups of staff that are going to be coming on board at the health district. One are community health workers, or what we refer to in the Spanish community as promotoras, testing site health educators, and care coordinators. There's an additional group as well, but this is what I wanted to share with you now because these are the groups that we intend to hire for. The community health workers are people who are lay educators who come into a community that they're familiar with and speak person to person with individuals. Well, we know that that has historically worked in other communities to educate people through real relational experiences. And people who are living in a community are often very well equipped to communicate to people real time and create a trust relationship. We have worked on this before at the health district and creating health educator models, but those are often through the medical community. So that entails someone going through a clinic system and then being connected to a health educator or a person who guides them through the process. These are actually people who will be embedded within the community. And so we're hiring with funding that we will review shortly. But they will be 20 positions part-time, and people will be working in the community to provide real-time information along the lines of the work that we've done through our new websites that we've created and certainly the educational material around COVID-19 that we are working on. These people will be working primarily on COVID-19 issues, but also the subsequent problems that people have as a result of the pandemic. The testing site health educators were really an idea that came from our directors, that we realized that at our community-based testing sites, there were people who needed additional information, and we realized that it wasn't enough to just test individuals at our testing sites, but we had to start the process of communicating best practices to them. We're finding, as an example, that some people were not clear about whether they needed to stay home after they'd been tested or whether there were things that they needed assistance with. And so we're finding that there are many people who are in crisis, and they come to the testing sites because they trust the process, but they also have additional needs. And so we can provide information, educational resources, and a soft handoff for other care coordination. And then the third group are care coordinators. Those are people who we intend to hire through a subcontract with our federally qualified health centers in our community, the 3 FQHCs. The goal is to create a system of care subcontracted through the FQHCs where we can coordinate assistance to people if they are positive and need assistance. So if somebody is having to stay home because they're positive with COVID-19, but they have needs like they're having difficulty paying their utilities, or they're having difficulty because they have food insecurity, or they don't have a relationship with a provider, or there's something as simple as the fact that they are unable to pick up their medications. We want to have a care coordination relationship with them. That's something that's happening for us through the State Department of Health now, but it is not as robust as we'd like. And so we feel that there's a need for that to be done locally, and the funding for that will come from the state. Are there any questions so far? Okay, if you could go to the next slide, please. We wanted to explain that the funding that we are receiving is coming from the State Department of Health, but realizing the incredible amount of work that we're doing at the local level, both for our directors in terms of their day jobs managing COVID-19, and also the realities that our staff are really inundated with work. The idea of hiring many new staff at the same time and bringing them on board, and also doing that through union relationships, and certainly as we adopt the Workday platform, was going to be difficult. So what we agreed to with the State Department of Health is that we would create a system where the State Department of Health would fund and hire certain groups of people, and they would be embedded at the health district. They would be under our direction and supervision, but they would be State Department of Health employees on a temporary one-year basis. The first group are an outbreak investigation team, and then the other group is called the case investigation or contact tracing team. The outbreak investigation team are going to be individuals who are going to do what we've been doing internally, but that takes a tremendous amount of time. If we know that there are issues with an investigation that needs to be conducted, let's say at a facility, and we know that there's been multiple cases of positive COVID-19, we want to be able to research that circumstance, get in touch with that facility, certainly speak with the individuals, and find out if there's a cluster. So we call that disease investigation, but we are calling this team the outbreak investigation team. So we are in the process of hiring people. We've already brought some staff on board. We'll have 1 lead and 8 consultants who will be doing that work on our behalf. And we're also intending to hire an epidemiologist who will be embedded again at the health district. So their group will be working very closely with our directors and our nursing team, but they will assume the load of investigating outbreaks as they occur. And that can be at congregate living facilities like long-term care facilities, farm worker housing, it could be at large agricultural centers or a supermarket. So the goal is to strengthen systems that we know work, but to allow us to have more staff to do so. The case investigation and contact tracing team is a little complex. We currently have contact tracers that are doing the work for our health district when someone becomes positive and needs to be contacted through the State Department of Health. That was something that was set up with Dr. John Weisman, the Secretary of Health, and the governor. Governor Inslee feels very strongly about contact tracing and set up a very robust system. But that is not something that's been under our direction. The goal of the state is now to bring that to the local level, and we feel that that's a good idea. Obviously, that would be a tremendous amount of money, and in the coming weeks, we're expecting funding that will come to us that allows us to hire a case investigation and contact tracing team at the health district. Again, it will be funding that comes. The reason that that's important is that there are times when there's information that's going through contact tracers, but there may be many different people at the State Department of Health who are contacting individuals, and they may not realize that there may be a connection between those individuals. So we feel very strongly that in order to do proper investigation and find out whether there may be a theme or a group of people who have been at, let's say, an outdoor party, or they've worked together, or perhaps they are part of the same social group, we want to be able to understand that process. So that's the case investigation and contact tracing team. We intend for that to begin shortly, but again, that's dependent on when we're allowed to do so. And we will continue to rely on the State Department of Health to support us with contact tracing until that's something that comes to the Yakima Health District. Do you mind going to the next screen, please? So we wanted to give you a brief timeline. Again, it's very high level because there are so many fluid parts here, but we are in the process now of starting to build these teams. We've been working throughout the summer to ensure that we have the funding available and the support to do so. And again, there are many people who have been involved in this, not only our staff and doing interviews, but also working with the team at the Department of Health who have allowed for the advertising and certainly bringing interested people into Yakima County. So we started in August with working on the funding, and then we are bringing on the new team members from the disease outbreak team, and we have some of them now. We're working on interviews for the health education process at testing sites so that we can embed that. That's happening as we speak. We're hoping to have our 9 positions fully on board through September for the disease outbreak team. So outbreak response should be up and running. And then we're looking at the new staff positions for contact tracing and certainly care coordination in September and October. We're also expecting to receive additional funding in October and November because this process has been something that has been committed to for 1 year moving forward. So it's not just through the end of 2020, but it's a 1-year commitment that the state is making. And the state has also indicated that they're interested in looking at a long-term process, but we do not have anything concrete yet. So I didn't want to commit to that yet for you. And then the next slide, please. Or I think that may be the last one. Of course. Now we're getting down to the funding. We wanted to talk to you about funding because, again, Chase will do his financial report, but we wanted to be clear where some of this funding is coming from because it's pretty complex and it's hard to keep track of. We've received $20,000 recently to continue a media campaign from the State Department of Health. That's, again, to continue the work that we've done in partnership with the state, and the state has been really interested in the work that we're doing. around building communication systems, and we've shared that with many counties so far. We have received an additional $511,000 that's CARES Act funding, and this is money that we're using for COVID response, but it will allow us to cover our operating costs. So we had received funding from the state and federal government in previous months. We've used those funds, and now we are relying on this $511,000 now to carry us through the next few months. It allows us to have our staff respond to work on projects that are COVID-19 related. Again, it's coming from the federal government, and so we're still following our process of sending federal and state monies first. Chase will go into more specifics about that, but that $511,000 is expected to be used August and September and October. We've also received $174,000 from the Department of Health. That has been something that they've really worked with us on to see how we could use nimble funding from the state to create more systems. And so we've actually used that money, and Lillian Bravo has taken the lead on that. But we are working on some really interesting processes here that we are pleased about. One is that there's a Microsoft investigation platform that we are investing in with state dollars, not our local money, but state funding, that will allow us to build a very real-time sort of epidemiology platform where we will be able to, on a computer system, target and follow where outbreaks occur at different sites. And we are very interested in doing this now because we are concerned about kids going back to school, and we want to make sure that we can actually not just have an idea about where we might have issues in a specific school as an example, but we want to be able to really pinpoint when there's targeted problems. And so that way we can upload a map, we can show where actually positive cases are located in a school. It's really going to be a wonderful tool. And again, it's a systems approach that the state is investing in with us. We're spending $20,000 on a contract to educate through Pacific Northwest University so that we can educate our promotores when we hire them so that they can go out and have a really strong health educator platform. We do also intend to hire people who are bilingual and who are culturally sensitive to the needs of our Spanish-speaking community. We're using $54,000 for health educators to come on board so that we can have people who are prepared to communicate real time with people as they come through testing sites. And we're also using $50,000 for our testing site courier service. We had expected that the state was going to create a testing courier service, but that didn't really come to fruition. We know that the Emergency Management Agency has been working hand in hand in courier services, but we really, as a rural county, know that we have to continue to be able to move tests as quickly to a processing site as possible. So that's where we're spending a lot of our money. And I wanted to update you on the fact that unfortunately we had some changes to the funding that we expected to come from the state. Last month we shared with you that we were expecting over $2 million to come through what's called the Epidemiology and Lab Capacity Grant. That money actually was retained by the state because that's actually a 30-month grant, and I believe the state is looking to retain those funds because they're not sure what next year looks like. But that money is being replaced with money that's coming directly from the state, CARES Act funding, that can be spent through December. So we anticipate similar money coming to us, but we have not received that money through what we call our consolidated contract. So the $511,000 that we currently have allows us to remain funded for COVID-19 expenses, but we are looking to also substantiate that with more funding from the state, which is coming shortly, as I understand it. So I've shared a lot with you. Happy to clarify anything or answer any questions that you may have.
I've got a question, Andre.
Yes, Commissioner.
So all of this gearing up and staffing up and the money that's coming from the state, is this in anticipation of moving forward phase 2 and beyond for our businesses and for our schools to open and all of that? Is that why we're getting all this extra help and structure?
Well, I think it's threefold. The first is that we were a tremendously affected county. And as a rural county that has traditionally been underinvested in, I think that this was an opportunity for the governor to recognize that Eastern Washington communities specifically, but rural communities throughout the state, have needs that cannot be addressed with current funding. We've been working on strengthening those funds over the years, but we do not have the fully funded investment in public health that I think is necessary to keep communities safe. So the reality of meeting this incredible demand could not be done with increased investment. So that's the first reason. The second reason is that we are recognizing now that we are going to be conducting COVID-19 response for many, many months to come. I think at the beginning of this, most people, including myself, thought this might be a short timeline. We're realizing now that this is something that we'll be living with, and COVID-19 is a reality that we have. So we have to create the investments long term. Your point is well taken that as we continue to do things and open up our community, there are more opportunities for things to fail. And the success that we've had in Yakima has been built not because it's been easy and not because we've had low numbers of positive COVID-19 cases, but because we've built a structured public health response that follows best practices and allows us to maintain oversight of the process. But strictly speaking, it's very difficult for a staff of 32 to maintain this. So that's why we're bringing on many new staff. And we also don't know what the future holds. So we are, you'll be hearing about this from Dr. Everson, but we'll also be moving into flu season and cold season. And so those may have a dramatic impact on how cases are transmitted in our community as well. So our plan is to be as well protected and have a strengthened system so whatever happens in the future, we're ready.
So if the governor is, I know we're paused on moving forward right now. Are other counties getting this structure? So maybe this is an anticipation of moving or reopening that and our ability to possibly move forward. I saw some changes in the scoreboard for risk assessment and things like that that made me wonder if there was any sort of imminent change state. Are you hearing anything?
No, I don't anticipate changes to the phases that we're in. The governor's office has maintained that they want to halt the phase changes for the immediate future. We, again, have, I think, become an example for the state of what a county can do to overcome a crisis. And so I think there's great confidence at the state level of investing in us. We know that contact tracing, as an example, is something that will come to every county, because again, the state is not intending to do that long term. But in terms of these specific investments, I think that, again, one of the reasons that we've been invested in is because that we've created real-time nimble structures that we're using as an example for other counties. And because we had so many crises at the beginning, we overcame things that counties are now having to deal with. So the investment that the state is making in us is something that we use as an example for others. We have not seen this investment in other communities. We do know that the state is pivoting to other counties now that are having more outbreaks than we are, and certainly having more difficulties. So that is part of the state's expectation, is to be able to pivot to communities and respond real time to their needs. But we have not only advocated for Yakima, but made it very clear that Eastern Washington had needs that had to be addressed. And one of the commitments that we made here was that we would invest in new staff and new structures that, if necessary, could provide support to neighboring counties. So it really is a regional approach if necessary. And I do want to emphasize that to the board, because if in the future we're doing exceedingly well, but neighboring counties are not, we'll be able to address some of their issues with support. And so I don't want that to come as a surprise. Are there other questions I can answer on this issue?
I have one really quick one, kind of related. On the risk assessment scoreboard, there was a change, and I don't know if we're going to be talking about that today, because it does really affect us, how they're doing the negative test data and so forth. But I'm also wondering about us, this funding and this discussion of us being a regional resource possibly. Is there an understanding that, because I know we've discussed this for months, that we're an ag county and that's why we've had specific issues, we've been open and essential the whole time. Is there a discussion of us having different criteria for, or the east side having different criteria for moving forward than the risk assessment scoreboard, or are we still sticking with that from what you are hearing?
No, my understanding is it continues. I think the recognition that we've received for the specific unique circumstances of Eastern Washington has been the ability to move forward within the modified phase 1. The creation of the modified phase 1 was something that we advocated for because we did feel that there was not a standard for rural communities that really made sense. And as you indicated, we've been an essential ag county, and so we have 63% essential businesses, which meant that we really never closed the way other communities did. That created I'd say an equal process of mitigating COVID-19, and so we've sought additional support services from the state, but I don't think you'll see a dramatic change. I do want to share also on that note that we are in discussions with the state because we have done well. We have low numbers currently, certainly with hospitalizations, intubations, and testing numbers. We're going to address those testing numbers again. We want the board to understand why we feel so committed and so strongly to community-based testing sites. But we are in discussions with the state about additional opportunities because, again, we've not only done well in our community, but we have overcome community apprehension about masking and social distancing. And you'll hear that from other directors who report today. So Gail, if you don't mind, those are the issues unless there's other questions. And I was hoping to go on to one other, address one other thing, if that's okay with you, Gail.
Sure. Let's just stop for a minute. Has anybody else joined the call?
Hey, this is Haley Larson. I'm just a citizen, but I couldn't unmute my phone in time to say something earlier.
Okay, thank you. Any others who have not identified themselves?
Hello, my name is Erica Ochoa and I work for the Yakima Health District, and I'm just going to hear some updates from Dr. Everson for our update later this morning on YPAC.
Okay, thank you. Any other people on the line who have not identified themselves? And I will remind people who are on the line who are not board members or staff that we will not be taking public comments during the meeting. So I'll get back to you, Andre.
Thank you so much, Gail. I just wanted to share that we realize in this response that COVID-19 is not just affecting us medically. It's also affecting us in terms of our comfort, and we're seeing that there's behavioral health issues throughout our valley. So as we accept the realities of shorter days and colder days, and certainly moving into fall, we anticipate that this will be something that has a striking effect on people, not only in terms of their emotional well-being and balance, but also there are financial hardships that people are overcoming. And as children begin to learn remotely in public schools, we're going to have childcare issues that I think are reflective not only here, but also around the United States. So we want to engage the board because we think that there are future COVID-19 investments that we may be able to make at the health district if in fact we receive the funding that we anticipate. When we talk about behavioral health, there are certainly things that come to mind for me immediately, like the issue of rising numbers of suicide attempts and increased cases of domestic abuse and general depression, and certainly the effect on children with adverse childhood experiences and people living with stress and food insecurity and limited financial means. So I don't propose to have an answer for how that's fixed, and these are really societal issues that we have to work on with our partners. But I did want to introduce the concept that we'll be looking to the board for your support and your thoughts and direction on issues that are COVID-19 related, because the COVID-19 pandemic is having such an impact on our community. And we feel very strongly that we have to begin the process of addressing this in our community now, because we anticipate so many hardships for people in the fall and winter. So if you have thoughts right now or suggestions or questions, I certainly don't want to monopolize the entire meeting, but I wanted to introduce that and share that that's something that we'd like to have as a future discussion with the board.
This is Kay Funk.
Yes, Dr. Funk.
I wanted to say that I'm very positively impressed with this program outline. It's very complicated, and it's very complicated to get boots on the ground where they need to be, where people are really having trouble. And because of the agricultural industry and the number of outbreaks and hotspots related to ag industry, it's critical to have these more robust forces available. And I'm very impressed with the work that you've done with the state to design this, because this is really a very new way of managing epidemics. And it's going to have a lot of positive impact going forward. I had sent in some questions about, I was concerned with I wasn't understanding the reporting of the number of tests being done, but I understand that you're going to get to that. Thank you.
Yes, we did some research, and you'll be hearing more of that subsequently. So thank you.
Great.
And I do want to thank you for your support, and I do want to recognize that not only have we received a great deal of support from the Department of Health, but our directors have been working really around the clock at creating this new system. We're certainly not doing this work to be cutting edge, but nonetheless, we find in ourselves in a whole new field of response, and this is only possible because of the hard work of the directors. So thank you. Are there any other questions that I can answer or the team can answer? Oh, Gail, I can't hear you. Gail, I'm
Thank
sorry.
you. Yeah, I couldn't unmute. So thank you. So if there are no other questions, let's go on to Chase Porter for the financial report. Chase is our Chief Financial Officer. So Chase.
Good morning, everyone. I actually have a lot to talk about, but for interest of time, I'm going to move real quick. So if there is something that you would like to ask me about, just please go ahead and interrupt me. First, I'd like to thank Dr. Funk for that comment. Andre had a great PowerPoint slide that makes everything blocked and simple-like, but it's been very, very complicated. And you can certainly see the state and local people really trying to move towards a common goal. So thank you for that. First, I'd like to introduce Minako, virtually introduce to her. I know she's having audio problems, so she can't quite get on and say hello to everybody. But she's here today. She's our new accountant. She started a couple weeks ago. She worked for the county for many years, and then she worked for Washington Beef for a while, and now she's come back to the fold, so to speak. So I'm very happy to have her and her experience. I'm excited to our future with her. So first of all, I'd like to address is we started an audit with the state auditor's office as of Monday. We've actually had our initial interviews. Gail had an interview with them yesterday morning, and Andre and I had interviews yesterday. You will be receiving, the board members will be receiving an invite for a opening interview meeting for everybody that's involved with that. So you'll be receiving that invite a little bit later today. So you don't need to be there, but you're certainly welcome to join. So for as you all know, we've implemented Workday at the end of June, beginning of July, and we're still working with a lot of the processes and getting things right in there. We're still working on getting out good reports, and so there's still a lot of work to do with that. Our old system, Cayenta, had everything smooth, but it was at its end of life, and now we have a very dynamic program that's getting off the ground, but it has a lot of things that we still need to work out. I would like to start on page 9, which is our vouchers approval. Generally, this is a part of the consent agenda, and I really don't speak to this month over month. And I just wanted to point out how little it is this month, because we only had one payroll run in July, which was just for half the month, the 1st through the 15th. And so that's why that amount is so small. And we actually had an accounts payable purchasing freeze between like the last 2 weeks of June and the almost first 15 days of July. So there's a bit of a backup, and that all has to do with timing as we transition systems. So moving into our actual financials, next page. So we had a monthly gain of about 160,000, and we had a prior period adjustment. A lot of our grants end at the end of June, so going into July, we're wrapping up grants. So there's generally a prior period adjustment in July every year. So our allocated budget is coming in at 3.7, and our total actuals is just above 3.7 for revenue. So we're really close as far as revenue comes, even though it's come in very many different ways. And expenditures, we had budgeted about $4 million at this point in time, and our actuality is coming in about $3.2 million. Moving into the next page, our monthly, you see we were over in our salaries and wages. So we are speaking to the month of July. In July, if you remembered, we moved into a modified phase at the very beginning around July 4th. So over the 4th of July weekend, we actually had additional staff come in and work that holiday weekend to make sure that if anybody had any questions, if the phone lines were being picked up and answered over the weekend. So that's the driver behind that. That's all I'm really going to speak to towards the income statement. Is there any questions, or I can review anything else? All right, moving into the program summaries. There's a lot of more or less the same trend as we're seeing. We're seeing large gains in programs that had flexible dollars allocated to that, because a lot of the work is now is in the COVID program. As Andre was saying earlier, we spend federal dollars first, state dollars second, and then local dollars last. And so right now we were utilizing COVID funding for those dollars. We saw an increase for a monthly increase in our on-site program. So that was a loss throughout this year. We still have a minor loss in that program, but we're seeing that bounce back. The same with the food program, which is on the next page. Oh, sorry, I was looking at my own. Will you scroll 2 more pages down? Yeah, so you can see COVID, we have spent about $814,000 so far this year. So it's we're expecting it to be around 1.6 as far as expenditures go, and so we are still on that track. And then move right down to the next page, please. And this is our second half of our program update. And I was saying that the food program, 560, the second program down, is rebounded in the month quite a bit. Next page, please. This is our COVID financial reporting. So as far as our funding over on the right-hand side, we're reflecting the additional $511,000 that we received earlier this year. Back in April, we received $650,000, which we have spent up now. Half of it was state and half is federal. The additional federal, you can see, is the grant that Andre was speaking to a little earlier this morning. Any questions about that? Okay, and finally, last but not least, the cash flow. We receive, so part of our flexible dollars, our local funding, is we receive $1 million each year. We receive $500,000 in January and $500,000 in July. And those funds can be used for any program here at the health district. And you can see that's what the uptick in our cash balance is, because we received that money in July. It'll trend down the next few months. But a combination of that and just the lower expenditures in July, because of our purchasing freeze and a change in payroll processing. That's the reason for that uptick. I went through that really quick. I could have gotten into a lot more details on very many different things, but we certainly probably want to talk about other things. Is there any other questions regarding this? All right, again, I apologize for moving so quickly, but I think we have other things that we'd like to discuss. So that is all from me.
Thank you, Chase. So I would appreciate a motion to approve the financial report for the month of July 2020.
I so move. This is Funk.
Thank you, Dr. Funk. Is there a second?
This is Ron. I will second.
Thank you. Just takes us a little while to unmute and mute again. So any discussion?
Yeah, just
Ryan, do you want to do the roll call?
Yes, for board members?
Yes.
Yes. Okay, so Barbara Hare. Barbara Hare. Okay, I heard her in the background. Norm Childress.
Yes.
Okay, and Vicki Baker.
Yes.
Okay, and is there any other guest or press that has arrived?
Okay, and we have a motion on the table. I guess I wasn't clear. So the question is for board members, do you approve the motion that's on the table to approve the financials for July 2020?
Aye.
Yes, Norm.
Yes, Funk.
Yes, Ron.
Aye, Sean Cleary.
Yes, Vicki Baker.
Thank you. Are there any opposed? I think that was all of us. Okay, thank you. The motion passes. Thank you. So
Thank you.
we will go on to department reports. So Ryan Ibach, Chief Operating Officer.
Okay, so first I want to start with through written communications through emails with Bob Romero, the Executive Director of the Yakima Family YMCA over the last week. He did have one email that was intended for written communication to present to the board. And has been read and approved by James Elliott, our attorney. So would you like me to read that for public record at this time? Yeah.
Yes, thank you, Ryan.
Yes, you're welcome. So Bob Romero, Executive Director for the Yakima Family YMCA wrote, kudos to the Yakima Health District for its testing and contact tracing. Our recent numbers are a reflection of your good work. Now, what does Yakima County need to do to move to phase 2? Businesses and organizations closed over 5 months are at a tipping point, and we have not been given the opportunity to operate responsibly. How is that equitable? And so I believe Bob's questions will be answered. Usually Dr. Everson addresses the metrics and moving to phases in her report. So I'll probably be addressing Dr. Everson's report. All right, so moving forward, one thing that I work on are, I work with all the schools in the Yakima County and meet weekly with all the superintendents and usually have daily phone calls, email communications with superintendents and principals throughout the week. And so Yakima County currently is at 70, Yakima County has more than 75 cases per 100,000 over the last 14 days. So we are considered to be high risk for students to go to do in-person learning. So it has been strongly recommended that schools in Yakima County go remote only, with the exception of up to 5 students with special needs per classroom can attend in person. So at this time, there are 9 private schools that have elected to have full enrollment in-person learning. And so we are working closely with those 9 schools to make sure that they're operating in a safe manner. All the other public schools have elected to hold off at this point and do remote learning only. And so we also are working with them as far as getting plans ready. So when they do go to in-person, and also what their plans are when they have the 5 people, 5 students per classroom in their classes, and also staff in the building. Any questions on schools?
Brian, I have a question.
Okay.
So it sounded like for the first time, we actually got some local control, excuse me, some local control in those decisions on that. So that metric of 75 per 100,000, was that a state metric, or were we given the local decision on that number, or how did that number come about?
Yeah, that came through the governor's office.
Okay.
So once that came through, then that's when we made that strong recommendation.
Okay. And how do we get local control for businesses and other things? Or is that just something that's being controlled in the governor's office? We're not going to see any actual local decisions on phases or anything like that. That's remaining in the governor's office, right? I mean, because it's kind of confusing, I think, for the public. They don't understand because they're hearing local control, but it's not really local control. So the school district's got to make some decisions on reopening, and I think everyone doesn't understand that. So can you help us understand what happened there?
Yeah, so as far as the schools going remote or in person in a hybrid model, the decision, the recommendation was made by the governor's office of the 75 cases per 100,000, and that was under a strong recommendation. And so we also in Yakima County strongly recommended, and so the public school superintendents took that recommendation and went remote only. The private schools felt that they had who have, for the most part, have smaller enrollments. I think the highest private school enrollment is about 300, and so they felt that they could do it in a safe manner. Does that answer your question?
Ryan, has there been any discussion of like outdoor fall sports or anything like that for the schools? Have they been talking about outdoor activities?
Yes, there are WIAA guidelines for sports, and they have determined what sports are different risks. So there's high, medium, and low level sports that are risk levels. And so at this point, they've decided to move back all sports in the state of Washington. So most of the fall sports are all going to be in the early spring, late winter when they start. And then so the first season will be starting in later this year with the regular winter sports will be starting a little bit later than they usually do.
Is that a local decision for the school district, or is that at the state?
Yeah, that's a statewide WIAA, which is a state organization. It was their decision.
Okay, thank
you.
you.
Can I jump in with a clarification as well?
Yeah.
There may be a little bit of confusion as we do have some schools open. There is more regulatory authority for public schools that comes from the state. So that's why there's a bit of a difference in the activity between public and private schools, as the state has more regulatory authority over what public schools do. And then I'll also make a comment as far as who's making decisions about things. So the governor and the state secretary of health are placing orders, providing guidance for how we should be operating safely. We are allowed to do things differently as far as we are providing more stringent recommendations. So we cannot loosen a recommendation from the state, but we can be more strict, if that makes sense.
Okay, any other questions on schools? Okay, I'll move on to community-based testing sites. So currently we have 2 community-based testing site units in Yakima County. At the end of July, we lost both of our National Guard units to other counties. However, we did request more National Guard testing units in Yakima County, and we did receive 1, and that unit started last Friday, their first testing. We also have MTI, which is Medical Teams International unit, that's doing testing in Yakima County. They are testing through the end of this week, and then they will be reassigned to do testing for the Yakima Indian Nation. And so at that time, we will only have 1 testing unit in Yakima County. However, we are working with a group called Health Commons, which is a group it's made up of Seattle firefighters, University of Washington Medicine, and other nonprofit groups that we're doing testing in Seattle King County. And so the state really liked the model that they use in Seattle King County, so they have contracted with this Health Commons to do testing throughout the state. And so we have requested 2 units or Health Commons to help us out with 2 units in Yakima County. And so we're working with, and what that is Health Commons actually, they come in and provide all the information, the guidance and training for groups, for community groups that will do the testing. And so they're only here for a limited amount of time until the community groups are up and running. And so we're working now with community partners to identify what organizations would be able to do this additional testing. And so, and it takes about 3 weeks from the beginning to get started with the testing. So we're hoping by the end of September, we'll have at least one unit and be working on a second unit to be doing community-based testing in Yakima County. And these are high throughput testing, so they can do up to 1,000 tests per day. Our goal to start out would be 500 as needed. And we want to identify a location in Yakima and locate a location in the Lower Valley to do testing, and they'd be at the set locations where the National Guard would be able to, they're mobile and they'd be able to go throughout the county and do testing, move around. Any questions on community-based testing? As far as numbers go, I believe Nathan will be following up on numbers that we've had with testing.
Ryan, this is Ron Anderson. Are these test kits, are they all from the same source? Are they multi-sourced? And do you have any information on their success and failure rate as far as being positive, negative testing?
I don't have that information. I don't know if Dr. Everson, if you have more information on success rates.
I guess it depends on what you mean by success. We do pay attention to the positivity rates that we get from different testing to make sure that it's seeming uniform across the county. If we see dramatic differences in the test rates across sites or from different facilities, then we try to look at whether or not there are any differences in the practices and the testing practices. So we pay attention to that. I guess I just don't know what you mean by test.
Well, as an example, the daughter of a friend of mine tested positive, and then 2 days later, her family was retested, and they all tested negative. So it was concern to me that maybe some of these test kits are giving false positives or those kinds of things. And my question, the other question was, are there multiple manufacturers of these, and do they all meet the same standards as far as how they're put together and how they're how they're built?
Okay, thank you for clarifying. We have discussions weekly among the group of health officers from across the state. So we meet weekly to discuss all kinds of issues, not the least of which is testing and how good is our testing. And one of the things that we talk about is how good is the performance of our testing. And some of that may come down to the actual test kit. And I know over the past 6 months, there have been many things in the news about being able to get test kits and what kind of media we're using, how good are the test kits, are the swabs okay? That seems to be less of an issue now than before. And now when we have these rare circumstances where we aren't sure whether or not a test result is valid, in particular a positive test result, because there are very, very few false positives, then we don't necessarily look at the quality of the kit. We look to see if there's anything different about the collection or the handling of the specimen. So your question is a good one as far as how much faith can we have in our test results. And in general, our positive test results are still quite reliable. There are rare cases of maybe how it was handled in the lab or some other extenuating circumstances that may lead to an incorrect result, but it's very rare to have incorrect positive results.
Thank you.
Yeah.
I've got a question about two of the metrics that it takes to move forward. And I know we've talked about this before, but one of those seems to be changing. So maybe, for example, if we're testing weekly of employees at a facility or something and it's negative over and over and over and over, we haven't been counting those, but we're going to be counting them going forward. Is that correct?
That, Dr. Everson, will you be addressing that in your report?
Yeah, I can answer that question now if that would be helpful. I can answer it quickly now, if that's okay. The state is moving to reporting positive numbers of tests and not just number of individuals tested. And part of the reason we're doing that is that we recognize that individuals may have numerous exposures throughout this COVID response. So we want to be gauging of all of the times where someone has needed a test and gotten a test, how often are they positive? So your question wasn't necessarily that. I'm answering it indirectly. It is a possibility that there's a facility that is doing routine testing. It's not a possibility. It's a fact that a facility that's doing routine testing, such as a long-term care facility, those weekly negative results are going to get included in those counts. So hopefully that answers the question. I understand why they're making this change. Very early on, maybe it was important to only be counting people one time, but we do have people who are repeatedly exposed, and it's good to know the bigger picture of all of possible exposures, how many of those are positive. That includes long-term care. If we are doing frequent testing, it's because we're worried about the risk in those facilities. We decrease the frequency of testing as the risk goes down.
So yeah, I mean, you're right. The reason why I'm asking is about the two metrics that we're counting. So one being that we have to have 50 negatives for every positive test, and that's really difficult to do. And so I'm wondering about that metric, whether it's going to be easier to meet.
My quick answer would be, it would be a benefit in that scenario then to be including our long-term care numbers of weekly testing if we know most of those are negative. You'll have a bigger denominator and a smaller numerator.
Yeah,
equation.
yeah, and
That's a good thing.
And the infection rate should go down as well as a result. Okay, thank you.
Yep.
All right, that is all that I have.
Hey, thank you very much, Ryan, and thank you for all your hard work. So let's go on to Nathan Johnson, our local emergency response coordinator. So Nathan.
Hey, good morning, everybody. I'll start with answering Dr. Funk's question as far as our community-based testing site numbers. So actually, if you go to both our website and County Emergency Management website, there's a calendar of where we're doing community-based testing sites. And there's two tabs: upcoming events, public calendar, and then previous events, public calendar. And that basically you'll see what team is where. And then if you scroll all the way over, you'll actually be able to see the number of tests that they do that day. And that's updated on a daily basis. I've also requested from County Emergency Management an Excel file that we could get sent to all of the board members after this meeting. That will kind of help make things a little bit easier for you all to view kind of what our community-based testing site numbers specifically have been from when we stopped with the 2 National Guards and got MPI, and then have now recently picked up an additional National Guard team. Dr. Funk, does that answer your question?
Yes, I think it answers the question. I have not been drilling down into the website, as I think that's what you're suggesting. I read the reports that are sent out, and as we've stated, doing larger numbers of tests is really important to increase the denominator, as Dr. Everson says. And I guess my main concern is between the time that the National Guard left at the end of July and the new unit came on a week ago, was there a drop of numbers of tests done, or was it a dramatic drop?
Okay, I think I heard you were kind of breaking up at points, but whether or not there was a big drop between when our National Guard teams left and when we got the new team. So thankfully we got medical teams international right at that time that the other Guard teams were leaving. So they've been here that entire month that we didn't have the 2 Guard teams. The 2 Guard teams together were collectively doing anywhere between 150 and maybe 250 tests a day. And Medical Teams International has been doing a fairly good job at being right around that 150 to 200 mark. So it hasn't been a huge decrease in the amount of testing. And there's been certainly some days where MPI has done a lot more than their usual time. So I think it was really critical to have MPI roll in right when we were losing those 2 National Guard teams.
Well, in that case, it is very exciting to see the number of new cases drop, the number of hospitalizations drop, and I'll take a look more on the website to see if I can suss that out, and I'll get in touch with you if I have any additional questions. Thank you.
Thank you, Dr. Funk. Continuing on, so as we see our numbers dropping, it makes everyone cautiously optimistic moving forward, but we from the health district know that our response is nowhere but over. We have a lot more room to go. We're really going to continue our response like we have done since day one around really a systematic or a system-based approach, creating these systems that are not short-term gap fixes, but really long-term fixes in providing a level of service to our community. Andre has mentioned some of those. I'm sure Melissa will talk more about what the plan is with schools, but building these outbreaks to increase our capabilities moving forward. And at the end of the day, we know COVID-19, though our cases are dropping, is still very much in our community, and it's affecting our community members on a daily basis, whether it's they're getting sick and having to isolate, or the unfortunate death. And so we're still going to be putting the gas pedal on our response moving forward. Some of the changes you'll start seeing, so the EOC, as of September 1st, will slightly be demobilizing. They've been operating over the last several months in very close coordination with us, but a lot of their staff members were volunteers. I think 4 or 5 of them actually worked with the county fire marshal's office, and so they'll be heading back to work on September 1st. We had a school nurse also volunteering in there, and she's headed back to work. So really, it's going to be emergency management's core team, which is a team of 4 going forth. So we'll still be in that unified command structure and being very closely coordinated with them on our response moving forward. At the health district, we'll be taking on some of those tasks that the EOC has been doing in the past, such as making sure facilities get the amount of test kits that they need on a daily basis, and also kind of helping facilitate the logistics around our community-based testing sites. The sit reps have also changed already. I'm sure you've seen. So the EOC is now pushing out a big countywide one on Mondays. And then on the rest of the days, they're just forwarding on the health district specific ones. Again, they're a small staff. They are very eager to continue to work very closely with us, but their capabilities are scaling back a little bit. But we'll be able to pick some of that up from the health district side of things. With that, we'll still be in that unified command moving forward. We know we have a lot of work to do. We know we're still in phase 1. And again, COVID-19 is still very real in our community. So we will be continuing working on systems around schools, outbreak response, getting test kits out, ensuring there's equitable testing throughout our entire community moving forward, especially as we get into the fall. With that, I will pause there. Oh, I will add one other thing. The EOC did a business mass distribution last Friday, and they pushed out in one day, they pushed out 409,060 masks to the business community. That was kind of their last big push to get some masks out to their community, the business community, which is huge. They're going to continue having a level of being able to get resources out, but it's going to be kind of scaled back again from that daily type of effort that they've been doing. So with that, I'll pause there. Happy to answer any questions.
Okay, thank you, Nathan. If there are no immediate questions, let's go to Dr. Everson, our health officer. Dr. Everson.
Thank you. Yes, good morning. I was putting together some thoughts for this meeting last night, and I made the reflection that it was 6 months ago today, after this board meeting, that I first heard about a case of community spread in California. So it feels about like 6 years, maybe for some were like 60 years, but that was 6 months ago today that we heard about that first case of local spread in the United States. I'm glad that I get to start my comments with some successes and some positivity, and I want to start with some numbers, some very good numbers. The first number I'll start with is 0. As of yesterday, we had 0 patients on a ventilator for COVID-19 infection. That's an enormous success after months and months of having at least a dozen folks on ventilators at a time. We had 15 patients in the hospital for COVID-19 infection as of our case counts yesterday, compared to 33 at our last Board of Health meeting, and our peak of 61 in early June. And that 61 was not including a number of transfers out of the county because we were at staffing capacity. So 15 patients in the hospital. We've been averaging just under 30 cases per day for the past week. And when we peaked with this pandemic locally in early June, we were at about 150 cases a day. So we're down to about 20% of what we were seeing at the peak, which is a great success. We have done almost 60,000 tests in our county so far, which is a great success. And the last number I'll give is 96%. That was our masking rate on our most recent survey. And I will further clarify that that is 98% in women who are observed in public. So women are exceeding the men routinely in masking to drive some competition there. Men, you're at about 94%. So I would love to see that be 100% someday. I don't know if we can do it, but I will thank the ladies for their masking so far, and men, you can do better. We have taken some calculated and very cautious steps forward together over the past couple of months. This is also a great success because much of the state is on pause right now with some peaking of numbers in most of the rest of the state. So that is a sign of our success in this measured and challenging, but measured approach that we've had towards continued improvement in some of these objective measures that we've been watching. And every month I do like to go over what the dashboard is saying for us. I will start by saying this dashboard is intended to provide some objective way of measuring how counties are doing. And these numbers are what the State Secretary of Health takes into consideration when deciding whether or not it's safe for a county to move forward. So are these hard and fast rules? Not necessarily, but they are taken very seriously into consideration. They're the most objective way that the Secretary has to consider whether or not it's safe for a county to move forward at a given time. So at the last Board of Health meeting, as far as our hospitalization rates were going, we were at about 71% capacity for our hospitals, with the metric being less than 80%. So we were meeting that one already. We are down to 53% hospital capacity, so even greater improvement. And some of that is due to lower COVID-19 activity, but some of it is also due to it being the summer. There's typically lower hospitalization rates in summer than there are in the winter. As far as how much of those hospitalizations are for COVID-19, 2 months ago, we were at 19% of our hospitalizations being for COVID-19. At the last Board of Health meeting, that was about 11%. And right now, 5.3% of our hospitalizations are for COVID-19. So continued improvement there and below the threshold. The goal is below 10%. Our rate of cases per 100,000 population for 2 weeks, which I think is the most confusing one for folks to wrap their head around, that one has also continued to decline. When we peaked, we were just under 700 cases per 100,000 per 2 weeks. At our last Board of Health, that was 390 cases per 100,000 per 2 weeks. And at our most recent calculation, we were just over 200 cases per 100,000 every 2 weeks. As a reminder, there are a couple of goals for what those numbers should be to be considered a low transmission area. The dashboard for moving forward into phase 2 and into some of those expanded indoor activities that folks are understandably hoping to expand is 25 cases per 100,000 every 14 days. So if we're currently at 200 and the goal is 25, we do have a ways to go. We're still making progress though. I wish I could pull out my crystal ball and give you an estimation of when are we gonna be there. I don't know if I can do that. I don't know if it's realistic for us to be to 25, but I think we can get closer than we are right now and we're headed in the right direction. And then another specific metric to keep in mind or goal to keep in mind, for the recommendations for reopening schools safely, the goal is 25 per 100,000 per 14 days for full in-person classes. And we're not close to that as far as being safe to reopen full in-person classes, but there's another goal of reaching at least 75 cases or no higher than 75 cases per 100,000 per 14 days for at least a hybrid model, meaning that some students are in school on certain days and other students are in school on other days, so alternating days so that you don't have such a large population in school at any given time. So again, numbers are dramatically improved. We're still considered a very high transmission area. With that, I will move on to our test positivity because I think we are likely not capturing the cases that we need to. Our test positivity has been fluctuating a bit with our changing testing availability. We are still averaging just under 25% when you look at all of the tests that we've done over the whole response to the pandemic. And in the past month, we've ranged anywhere between 10 and 25% test positivity, depending on the day, depending on the week. So that is fluctuating somewhat depending on our testing availability. And again, Vicki has mentioned what this goal is, but the goal is to have less than 2% positivity, which means if every 50 people you test, one of them will be positive. That's the goal for knowing that you're doing enough tests. So those are the current numbers. They are all headed in the right direction. While we have greatly improved our community transmission, I will state again, we're still considered a high transmission area, which is a tough place for us to all be in together psychologically, because we are feeling a little bit relieved. Things are so much better. It's hard to have this sense that we're still in danger, but we're still in danger. So I just wanted to say that explicitly. It's not time for us to relax at all. With our schools, I know Ryan has commented on this already, we have recommended strongly that schools stick to distance learning as much as possible. There are some exceptions for very small numbers of students, meaning less than 5 at a time, students who are most at risk for falling behind with remote learning. And then, as we've discussed, there are also a number of private schools who have chosen to move forward with in-person school, and we'll continue to work with them on making them as safe as possible, making sure that they are ready to respond real time with information and support for families if they do have a case. So while we are very clear that we think distance learning is the best option at this time, for public school or private schools who can choose to open despite this recommendation, we're making sure they have the support they need and that their students and families and staff have the support they need to be as safe as possible. We've talked about testing quite a bit already. We continue to discuss our testing strategy almost daily as a leadership team at the health district. And we are currently fortunate that our testing capacity is exceeding demand, meaning that we have tests available for folks to do if they come to our community-based testing sites. We, again, as Ryan mentioned, are working on establishing a couple of different permanent locations so that folks don't necessarily have to reference our website to figure out where to go to get testing on a given day. And we also continue to look at how to make that most accessible for folks, meaning can we have after-hours options, weekend options, that kind of thing, to make sure that we're being equitable in our testing response. The flip side of us currently having more testing capacity than demand is that this test positivity rate is higher than it should be. I think folks have gotten a little bit more relaxed because it feels like things are better and they're not being quite as diligent about going and getting testing. But we do need to be expanding testing. So if you have any role for reminding folks, if you have any symptoms at all, even if you're sure it's your allergies or you think it's just a summer cold, it's really important for people to go get tests. And then we're also still recommending that folks who are close contacts of COVID-19 cases should get tested as well. Not everybody who acquires or gets COVID-19 from someone else will have symptoms, but even if you're someone who doesn't have symptoms, you can still spread it yourself. So it's really important for close contacts to be getting tested. And the definition for close contact, the simplest definition for close contact is anybody who has been within 6 feet of a COVID positive individual for 15 minutes or more, and that's regardless of mask use. I don't want to give the impression that it is not worthwhile to wear your mask. Please wear your mask, but the current CDC recommendation for who should get tested says that if you are spending a great amount of time with someone, meaning more than 15 minutes, regardless of whether you have a mask on, you should get tested. Part of that is because people are variable with how they wear their masks. They may be below your nose, below your chin. They may be very loose. So because we can't necessarily control the quality of the mask or the mask wearing, we recommend that folks who are close contacts get tested. I know that there are a lot of folks who are worried that the more testing we do, the worse that may make things look for our county. So I do want to address that. More testing does necessarily mean that we are finding more cases, but that doesn't mean that we're necessarily putting ourselves behind in our efforts to open our schools or our efforts to reopen our county. Verifying a case, meaning finding a case and confirming it, and then communicating with their contacts really helps us control spread better, so less cases moving forward from those cases. And then I also want to remind folks that we aren't just looking at case counts when we make our decisions locally or at the state level. We know that case finding is very dependent on testing. We also look at more objective measures of how we're doing, like hospitalization. So I've long talked about watching our hospitalization rates as a better objective measure of how we're doing with community transmission. It is a fact of this virus that a certain percentage of people who are sick will end up in the hospital. So that kind of thing does not change based on how much testing we're doing. So watching our hospitalization rates go down is very reassuring to me that our transmission is in fact declining. So for those who are worried that if they get a test, it means our number is going to look worse, please don't worry about that. That's not the only thing we're looking at. We always take it with a grain of salt when we see those test numbers fluctuate, because there's so many factors that go into those numbers. We have long prioritized safety of our long-term care facilities and our essential workforce, and in particular agricultural employees. And I'm glad to see all of our efforts realized to increase staffing for outbreak response to be able to provide that much more support to the community. We have been focusing a lot of our staff time there, and we are glad that we can do a little bit more breathing with more dedicated staff to that, hiring additional dedicated staff to that, that frees up our previous staff to be doing some of the other public health activities that are usually part of their day-to-day work. So we are, I mentioned marathoning and how this is similar to marathoning. We have all been sprinting for a long time with this extra staff. Hopefully we can kind of break back into a normal stride soon. We're not quite there yet, but hopefully soon. We have been working on preparedness for vaccine distribution when there is a safe, effective vaccine that is widely available. The CDC has been doing a series of preparatory webinars for health districts and state health departments, looking ahead to that. And just to remind folks, that kind of vaccine distribution or widespread vaccine distribution is something that we plan for day to day, even when we're not in the middle of a pandemic. It's just part of emergency preparedness and response. But we have been doing some additional planning on that front. I think we're still several months away from having a vaccine that is safe and effective for widespread distribution. We also continue to look at some of the other outcomes of this pandemic. Andre mentioned some of these as far as seeing increased rates of intimate partner violence, increased rates of adverse childhood experiences, worsening outcomes from a mental health standpoint with respect to substance use disorder. So for folks who are worried that we have the blinders on and we're just worried about COVID-19 infections and people who are sick from that or in the hospital from that, we don't have the blinders on. We're really looking at how this is impacting the community as a whole and working our response to all of these additional outcomes of this pandemic. I do want to spend a bit of time talking about heading into the fall season and traditional respiratory illness season that includes influenza. And we need to keep focused on all of the safety measures that have gotten us to where we are with COVID-19, as these same safety measures are the things that will help protect us from other respiratory illnesses. So that's the masking in public and anytime around people outside of our household, avoiding gatherings with people when not necessary, especially indoor gatherings are not safe. Isolating when you're sick, quarantining when you're exposed, testing if you're ill or exposed, following proper hand hygiene and sanitizing practices. We kind of joked early on, well, what have we all been doing so far? Was nobody washing their hands before? Certainly we weren't all wearing masks during flu season, but there was some joking early on, like, didn't we know that we were supposed to be washing our hands and covering our coughs? Because we know those things help to control spread of other illnesses. So all of these things we've been doing for COVID-19 hopefully will help us curb some of these other infections, including influenza. With that, it is going to be exceedingly important for folks to get their influenza vaccine this year. the more respiratory illness spread we have, the more confusing the picture will be as far as how much COVID-19 is out there, the harder of a job it is for our clinics and our hospitals to be determining who is sick with what. And the bigger problem is the more disruptive it will be to our workplaces, to our daycares, to our schools, when there are folks who have respiratory symptoms. So the best that we can do to help limit the spread of all of these respiratory illnesses, the less disruption that we will have in all of these settings. So I just ask everybody to recommit to all of these safety practices. I also want to ask people to remember to take care of their physical health. We've all been so focused on COVID-19 and COVID-19 prevention for a long time. And some of us have been hesitant to go to doctor's offices with fear for maybe picking up a virus when you're out. But safety practices are quite good. They've been in place for a long time at your doctor's offices. So please make sure you're taking care of your physical health, because folks who have chronic health conditions like diabetes and chronic kidney disease, chronic lung disease, chronic heart disease, are at increased risk of severe outcomes with COVID-19 infection. So please make sure you're attending to your health and going to those checkups. The other thing I want to mention is that vaccination rates continue to be down, and we cannot really afford to have another outbreak right now. So that includes not only childhood vaccines being down, and they are quite reduced across our county and across the state. So we need parents to make sure that their kids are getting caught up on childhood vaccines, especially if your kids are in daycare or if they're attending any kind of in-school class, or if they spend time with cousins or anybody outside the home. So please make sure you're catching up on routine vaccines. But also for adults, just a reminder that is getting the flu vaccine. It will be increasingly available over the next 1 to 2 months. The influenza experts locally, meaning domestically in the US, and at the world level, the World Health Organization, recommend that we get to a rate of about 70 to 80% of community vaccination for influenza to help prevent spread of influenza. So I think that is a good goal for our county. We've shown that we can mask at 96% and some of us at 98%. I think we can do better than in years past at our influenza vaccination. I think that is just about it. I'm kind of hinting at something that I want to make explicit. We all have a role to play in the safety and health of our community. Public health is not something that the healthcare system provides to you. It's not something the health district provides to you. Each and every one of us contributes to our local public health. And there are things that are part of your duty to your neighbors, to your community, to help ensure public health. And one of those things is masking, and we've all committed to that. But getting recommended vaccinations, I see as another part of your job to maintain your local public health. Your vaccine doesn't just help protect you from getting the flu, but you're being protected against the flu as one less person who can help spread it around the community. So I do see things like masking and vaccination as part of your job as a member of your community. So I urge everybody to get a vaccination, and just from a guideline standpoint, anybody over the age of 6 months is recommended to have an influenza vaccination. So I will stop there. The last thing that I'll say is I am exceedingly proud of our health district team and inspired by them and how much work they've done over the past 6 months. I continue to be inspired by the resilience and strength of our county, and that's it. I would gladly take your questions.
Okay, thank you, Dr. Everson. Questions?
Vicki.
I would like to ask a couple questions. Well, actually, we saw a little bit of a sneak peek. I don't know if we were supposed to see that during your presentation, but I wanted to reference some of the meetings last week we had about moving forward. One thing I just wanted everybody to know who would be concerned about that, and we've had this discussion before, is the 4th of July. We opened on the 2nd with our modified phase 1. We had at that time about 581 cases per 100,000. And even though the mall's open and we opened quite a few things with that first modified phase, we continue to see ourselves go down, and great masking rates, and our community has really done an excellent job. And so I just want to have everybody feel comfortable that, we've done great progress even though we've been open. And I'm hoping that we're, you talked about, physical health, and, we've talked about fitness and health clubs and the Y and things like that being open so people can be healthier. I know there's been some concern at the state about that, but I also think, if you have the mall open, we need to be, considering some of those physical health things that we could be doing, or maybe outdoor activities and sports and things like that. So I know we've already talked about all of that, but I just feel like we've made great progress, even though we have some things open. So I think you might be addressing that shortly. I'm not sure, what's on the schedule here, but I just wanted to make a comment about our progress, even though we've been open, and encourage you and everybody else that we can continue to open and do better.
Yeah, thank you. Our success, meaning our continued decrease in cases, even though we've taken these little steps forward, has not gone unnoticed by any measure, and we have been highlighted as a success across the state for the past couple of months now, which is a good feeling for us. I do want to say that we, not just me, but this is also the state and the world really, we're all still quite concerned about indoor transmission for folks that are for areas that still have high case counts. So when we are considering what are the safe next steps, we are always hesitant to make indoor things the next step. And we're always considering what are the safest indoor things to be doing. And part of that is, what kinds of activities are people doing indoors? Are they doing things where they are talking loud, breathing hard, singing, things that we think have more capacity to spread virus, even with a mask on? We think about things like, how big is the space that we're talking about? So one of the things that we've been talking about is it safe for us to have indoor church services? And when we think about that kind of thing, we also think about how big is the average inside of a church. It's quite big. So just know that we take all of these things into consideration when we're thinking about what is safe moving forward. And we are trying to be thoughtful with how we choose to move forward, what things are the safest things for us to start with.
Yes, and if I may, actually, I'm sorry to intervene, but I did think it's appropriate to share that we've just received information from the state. I don't want to hijack our meeting, but I do.
I'm glad you're doing it. I was thinking about saying it, but I thought you might want to.
The importance of timing is important to me in terms of sharing things with the board, but we've just received information that there's been an approved change to the modified phase 1. The reality is that we've been in discussions with the state and our numbers have increased, or rather our numbers have decreased, but we're actually in a very good position. So I wanted to share the good news with you. This is something that's happening for our county as well as Chelan and Douglas and Benton and Franklin. So if that's okay, Gail, I'd like to ask Ryan to review the things that have just been approved for our county.
Absolutely. This is perfect timing. So thank you very much. So I believe there is information that can be up on the screen. And then Ryan, can you, thank you. So Ryan Iback.
Yes, Ryan Iback, Chief Operating Officer. So what I want to do is just go over the 12 new items that have been added to our roadmap to recovery. These will go in effect starting tomorrow. And so I'll just go over them right now. The first activity is outdoor group fitness. So these are classes that are allowed to be outdoors with 5 people, which does not include the instructor, to be outdoors. So like aerobics, yoga, other type physical activity outdoors, of course, with physical distancing at least 6 feet. The next one is social gatherings. The big change on the social gatherings, it's allowed to be with people outside your household. So up to 5 people outdoors with people outside your household. Construction's the same, manufacturing's the same. Real estate's another change. So real estate's allowed under phase 2 guidelines. It can be guest occupancy limited to 25% of building occupancy, and indoor services up to 30 minutes. Another change is in-store retail. Right now we are at 25%, and so we've gone to phase 2 guidance, which in phase 2 guidance allows up to 30%. So the slight change there. Personal services are the same. Professional services, that's according to phase 2 guidance. So this would be like office type settings that aren't open already. They can now have occupancy limited to 25% of building and up to 30 minutes per customer. Professional photography has been added, and this is according to the phase 2 guidance. Domestic services has been added, which is according to phase 2 guidance. Another one is restaurants, taverns, breweries, and wineries. It's allowed to have 25% capacity indoors. However, it does say on here, outdoor seating is permitted at 50% capacity, and we have had all along, we've had just outdoor, there's no capacity for outdoor as long as there's social distancing, proper distancing. So that will be the same. However, 25% of maximum building occupancy indoors for restaurants, taverns, breweries, and wineries. Staff water recreation is the same. Religious services is under phase 2 guidance. And so indoor services will be allowed at 25% room capacity or up to 50 people, whichever is less. And so, and also another thing that's in phase 2 is it also allows up to 200 people for outdoor services. So right now we were at 100, so that increases to 200. So the big difference on this one is the indoor capacity up to 25% or 50 people, whichever is less. One change in the drive-in movie theaters, it's now phase 2, and that allows for concession stands. So right now, concessions are only served to they have to be ordered and served to the car, but now people can go ahead and go to a concession stand and order concessions as long as there's proper masking is required and also proper distancing. Another thing that was added to the modified list is team gymnastics, including training for U.S. gymnastics. So there is phase 2 guidance for gymnastics, and so the state has approved this guidance to be in our modified phase 1. And then the last item is there also is phase 2 guidance for outdoor card rooms. And so this will be allowed, outdoor card rooms, designated areas, limit of 50 people, which excludes the organization staff. And again, proper distancing is required. So there's a lot of phase 2 guidance that has been approved. However, we are still in a modified phase 1, but we are able to allow these phase 2 guidance.
So I think this is very important, and you're right, timing is everything for our ability to even announce this at the board meeting today. But I do have to say this is a lot of hard work to be able to move forward. It's a recognition about what our county has been able to do, and also with the staff being able to be in constant communication. As you know, from a statewide basis, the governor is not allowing movement in between from one phase to another, but within the modified phase 1, to be able to add these really is a testament to what our public has been doing. So thank you. So other comments, Andre?
Well, again, I apologize for the short notice. We did not have anything definitive before this meeting, and we just received that. And also, we wanted to make sure that what we could quickly review would be up to date with what we anticipated. You are correct, Gail. This is still considered modified phase 1. It has no bearing on whether we move to a different phase. But I think you said it perfectly. This is a recognition of the ability for our community, Yakima County, and all of the hardworking folks in our community who have overcome great odds here and have really committed to best practices. Ryan continues to monitor and work with our partners on the masking efforts and the review of those masking efforts, and our numbers remain very high. So thank you to the community for allowing these things to happen. Without the community, this wouldn't be possible. Again, this is being thrown at you in the middle of a meeting. We usually like to plan these differently, but this is where we find ourselves. So if you have any questions specifically, we like to. Our plan will be to work with our partners. This is a very tight deadline. We will make certain that our partners and advocates for local businesses in the community are familiar with this. They'll send out press releases, and we'll also have staff prepared to answer phones and over the next few days until the call volume decreases. We want to be of service to the community in that regard as well. So any questions you have, we're happy to answer them.
And real quick, a couple of notes too, when we've had discussions with State Department of Health, is they have mentioned how proud they are of the progress that our community has made. They do want to make sure that we don't go backwards, and they've seen other counties that have seen large increases when they have opened up. So we want to continue to see schools and other activities open up.
Well, I just want to say I'm grateful to have, forward motion, of course, and I'm, I know this is out of the comfort zone a little bit, so I do appreciate that we're moving, especially for some of the businesses that are in the phase 2 guidance. And I am concerned for the businesses that didn't make it to this list. And of course, that creates some winners and losers. I don't like that, but we'll keep working on that. I know. The other thing I think it'd be important for everyone to understand is that this is all the counties moving with this. And so, and for the public and any businesses to know, to look at the local guidance always. We've talked about this in our meetings constantly, how we communicate this to the public and make sure that it's really clear that they don't Google and look at guidance for other places. We really have to have our local health district as the source of information. And anyway, thank you to the staff. You guys have worked hard on this. I know that. And for moving forward.
I would concur with the comments of Commissioner Baker. Ryan, will this be sent out to us, to the board members?
Yes, this will be sent out to the board members. It'll be on our website, and also we will be putting it on a media release.
Yeah, because I'd like to have a copy in hand so that as this moves along, I'll have it for a reference. Thank you.
Okay, and then Sean will, in his report, he'll discuss the guidance, because we will have all the guidance on our website also.
Okay, great. Thank you.
And then the only other thing I'd like to ask of everyone in the community is that we have to remain vigilant because we're moving into a different area of indoor activities. And it's very important, as Ryan indicated, that we do not have increased cases. And we want to make sure that every single person in this community is as safe as possible.
And I think, Andre, that needs to be a part of the new messaging with these changes, so that the public is aware from the get-go as to we need to continue to, we're at a very good place now, but we need to continue to not only just stay there, but improve our situation so that we can keep moving forward and make this a positive effort on to the community.
Thank you, Commissioner.
That was a great soundbite.
I want to add also that I think the public doesn't understand the process for these negotiations and how it's working. So I think it's important everybody understands too that if we continue to decline, we will still have conversations about the businesses that weren't included, and moving forward. I mean, those conversations are happening regularly.
Yes, I do. Again, I want to reiterate that even though things are outlined as phase 2 guidance, this continues to be modified phase 1. We continue to be in a circumstance where the governor's office has said that no county will move into an increased phase. So again, from a statewide perspective, what we're told is that we will remain in modified phase 1 indefinitely. We do want to continue to ensure that we do not have any more outbreaks. So I totally understand your point, Commissioner. But I do want to make certain that it's clear that the changes in those phases rest at the governor's level.
Okay, I'm going to move us along with that good news, and let's go to Melissa Sixberry, who's the Director of Disease Control.
Thank you. So I'll just start off with saying welcoming Tonya Brett, who's our new public health nurse. That position has been vacant since March, so we're really glad to have her on board to help get us back into communicable diseases aside from just COVID. I'm going to kind of veer off from COVID a little bit and just talk about some of the other things we have going on, one being a Salmonella outbreak. There's a couple of nationwide outbreaks related with Salmonella, one related to onions. We have 2 Yakima County residents who are part of that nationwide outbreak linked to onions and Salmonella. And we also have 1 Yakima County resident linked to the Salmonella nationwide outbreak related to backyard poultry. Last month, I reported on our Hep A outbreak that started almost a year ago, that we were getting close to declaring that outbreak over. I can now say we've gone our 2 incubation periods, which is 100 days without a case of acute Hep A. So we are now declaring our Hep A outbreak over. So good news there. And then I'll just add one thing on COVID-19 with the schools. One thing we are doing is Monday we did do a training with all of the school nurses and the point of contact for the medical for schools to talk to them about what an outbreak would look like, what their role will be, what our role will be, and how we will all work together to address those. And we will be having standing weekly meetings with the schools to stay in communication with them for any questions that they have. So we'll be working very closely with the schools to stay on top of any outbreaks. That's my report. And if there's any questions, I'd be happy to answer.
Thank you very much. So let's go on to Sean Mcgee, our Director of Environmental Health. Sean.
Sorry about that. First off, I'll discuss what EH has been up to with the onboard of the outbreak response team from VOH. It's taken a lot of pressure off of our EH staff to turn their attentions a lot more towards some of our EH services, which a lot of our stakeholders in our EH programs weren't as greatly affected by us being in phase 1 or, during the stay-at-home order. A lot of those services were allowed to continue with some of the construction and land development aspects of our program. So while we were closed down for a while, there was a little bit of a backlog of cases. We've been working really hard over the last several weeks to get that caught up. And I'm happy to say that we are nearly there. We are scheduling our appointments for new applications coming in, as per usual during our busy season. So things are moving well, and we're getting back on track with environmental health. So it's really big success for us on that regard. As for the new additions to our modified phase 1, I have the toolkits essentially ready to go for each of the new activities that were identified just a few minutes ago. Those will be posted on our website. Those will be distributed amongst some of our partners on the Business Reopen Task Force, as well as a new tool that will be on the Yakima Valley Open and Safe website. It's a website for the Yakima Valley Tourism Office. We're calling it the grid document. So it basically has all the upfront specific information for each business and activity and where it stands in our modified phase 1 in Yakima County. There's also active links that bring up the specific toolkit for that topic, as well as there will be some documents that contain frequently asked questions and answers to those questions linked to there. So businesses, community members can access all the local information specific to Yakima County from that document. So we'll be pushing that out as well. John Cooper over at Yakima Valley Tourism is ready to go once that document is updated, and they'll put that on their site and it'll go live very, very shortly. So we're excited with the being able to push out this information to help these businesses, hopefully to give them all the information they need up front so they don't have to call a bunch of different organizations to try to find the answers they need. So it's an effort to streamline the information that's needed to our community. So that's my report, short and sweet.
Thank you, Sean. Any questions for Sean?
Not a question, just a comment. Thank you, Sean. I think that's going to really help our communication this time. That grid document will make it clear for businesses and they'll have one place to go. So thank you. I know that was hard work. I appreciate it.
No problem. Thank you.
Okay, let's go on to Lillian Bravo, our Director of Public Health Partnerships and our Public Information Officer. So Lillian.
Thank you. So I'll also keep it pretty short. Andre discussed a lot of the work that our team's been working on and talking about the Promotora de Salud program, or the community health worker program, as well as developing the new testing model of health education at the testing sites. So that's, we're really excited to have been able to put that in place. I did want to mention that some of that work was supported through a fellow that we housed here at the Yakima Health District from Central Washington University. So Debbie Rich, she's a Master of Public Health student who is here supporting us through COVID-19 efforts. So I wanted to point that out as well. And to also mention that we received news that the Yakima Health District was selected as a host site for a Public Health Associates program. That program is housed through the Centers of Disease Control. It's a competitive 2-year paid training program. And what that means is that we'll be hosting a bachelor's level associate who's interested in public health. They'll be doing their training here at the Yakima Health District. And as of right now, we're planning on having them assist with community assessment, communications, and other evaluation work. So we're excited to have been selected as a site for that Center for Disease Control program. And we'll of course have more information in the fall once we get the associate on board. And in tune with everyone else's comments, again, we want to recognize that with all the additional support and structure that we've been able to put in place, we can now resume some of our normal programming, that being the breast, cervical, colon health program, developmental disabilities program, immunizations, nutrition education, tobacco and marijuana prevention. There's lots of other work that there is to do, and we're excited to be able to do get that back on track, as well as to continue to respond to the COVID-19 outbreak in our community. And with that, I did also want to recognize that part of that work within immunizations is working with our local providers to make sure that the school-age children are staying up to date with their immunizations. So we've been working with local providers, managed care organizations, and other partners to incentivize families to come in and get their routine immunizations. And we'll also have more updates about some of the flu vaccination work that we'll be doing as well. So I'll leave it at that unless there's any other questions.
Okay, thank you, Lillian. Any questions for Lillian? Okay, thank you. First of all, I'd like to recognize not only the staff, but the members of the Board of Health. Everybody has been working so hard, and our community has responded because of the leadership that all of you show. So thank you very much. So our last item is just if there are any other business to come before the board. Hearing none, I think we have a lot to celebrate today. And again, thank you very much. I will adjourn the meeting. So I will, bye.
Thank you all.
I will just assume that I don't need a motion, but I can take one. Okay, give me a motion to adjourn the meeting.
So moved.
Is there a second?
Second.
All those in favor say aye.
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 All those opposed,
Aye.
same sign. Thank you very much for all your hard work.
Thank you, everyone.
Thanks, everybody.
Thank you.
Bye.
Yeah, well, that's good for Michael Morris. I think that pretty well covers it, right?